IVF is in vitro fertilization by definition, but of course it is a process, and it's a process whereby we undertake stimulation of the ovaries to collect eggs, to fertilize in the laboratory to create embryos for transfer. That's a very, very shortened version of the IVF process, but that's it in a nutshell. Couples often ask me if there are any problems or issues going through IVF treatment and if it's a safe process to proceed with. And in fact, the stimulation is very straightforward. The egg collection procedure is associated with a small risk of infection, for which patients are given antibiotics. But overall, the process is very safe. The issues often arise as well as, is this safe for a baby? If I have a baby from IVF treatment, is that baby going to be normal? And of course, there is a wealth of data out there following children right through from 1978, when Louise Brown was born, to say that actually children do very well developmentally and there are no difference in outcomes for IVF babies or babies conceived naturally. Once a decision has been made to proceed with IVF treatment, that process will usually start on the second day of somebody's bleed. And women are injecting for a period of approximately 12 to 14 days, during which time they need to come for several scans. This is then followed by an egg collection procedure. The eggs are collected and then fertilized in the laboratory, and embryos are created 5 or 6 days later, which are either frozen or we can transfer an embryo in that cycle. So whilst from time of decision making to point of starting stimulation can be very variable, of course, but from starting the stimulation to the actual egg retrieval is approximately 14 days, so it's very short. One question that couples often want to know is how many eggs they might collect from a stimulation cycle. Well, that's very much determined by the woman's ovarian reserve. Now, we do a blood test before starting that treatment, and this is called an AMH test, an anti-Mullerian hormone test. And this gives us an excellent guide as to the number of eggs we might collect from one stimulation cycle. So we can give you very good advice on how many eggs we might collect. And of course, we're talking to you throughout the whole treatment and scanning you so that we will also be able to manage your expectations on what that number may be. The decision on how many embryos we might transfer in a treatment cycle is determined by, of course, a woman's age, number of cycles they may have had already, and the number of embryos available. The recommendation is usually to transfer 1 embryo, but occasionally we might make that decision to transfer 2. In fact, by law, women over the age of 40 are allowed to have 3 embryos transferred, but that's something we rarely do these days. Some women may have more than 1 cycle or may proceed from a fresh cycle to a frozen cycle and often ask the question of whether or not they need a break between those cycles. That's very much dependent on how you're feeling. And you can move straight from 1 cycle to the next, and sometimes we do that to expedite a process. So there's no right or wrong answer to do I need a break between cycles? And that's an ongoing discussion at the time.